So this is Hydrotherapy Theory and Practice, Part 9, part of an ongoing series here. And just a reminder that if you have any health condition, you want to make sure you partner with somebody who has a similar philosophy of care, the human body that you do. Just makes things more smoothly operating and synergistic. That the things here that we talk about are just additional tools for your toolbox that others have used. Just always to do your own due diligence and checking things out. The Newark Advocate in January of 1903 quoted Thomas Edison as saying that the doctor of the future won't be giving medicine, but will instruct his patient in the care of their bodies and what they eat and the cause and prevention of disease. And that forward-thinking idea was actually talked about even before that, back in 1885, where in Testimonies for the Church, Ellen White states that there's only one way that heaven approves of practicing the healing art, and that's using the simple agencies of nature that don't debilitate or tax the system through their powerful properties. Even back in biblical times, there was a focus on health. 3 John 1 verse 2, beloved, I pray that you prosper in all things and be in health just as your soul prospers. And our soul needs to prosper in order for it to be our bodies to be healthy. If it's not healthy, then our bodies will follow suit. Romans 12, 1 and 2, it's presented that we give our bodies as a living sacrifice, which is holy and acceptable, without blemish, which is our reasonable service, not to be conformed to the world, but transformed by the renewing of your mind. We're kind of dealt certain things in life that we can't change, but those things that we can change and enhance, we need to do our best to avail ourselves of those things and practices. In the ministry of healing, we're told that the knowledge that man is to be the temple for God and a habitation for the revealing of his glory, which is otherwise known as his character, should be the highest incentive to care for our development of our physical powers. We're fearfully and wonderfully made. And he bids us to make it our study, that is our bodies, and understand its needs. So we need to listen to our bodies and know what it needs and respond appropriately. And then act our part in preserving it from harm and defilement, because we don't want to defile the temple of the living God, which we are, according to Corinthians. So looking at some physiological goals and objectives of hydrotherapy, we've been talking about that the last couple of times. We'll wrap up that particular segment here of our theory of hydrotherapy. Hydrotherapy can encourage metabolic activity, i.e. increasing the activity of a different organ or a system. So most chronic diseases come from some kind of a metabolic disturbance, i.e. an organ isn't functioning as it should, like underperforming or overperforming. And that can be due to a lack of adequate nutrition, which can cause a metabolic disturbance, or from inactive use of those organs. So, for example, you can have lung issues develop just from shallow breathing and not using your full lung capacity. A good example of that's pneumonia. That can creep up on people who aren't using their full lung capacity. And that happens with other organs and glands too. So the most powerful benefit that is seen in encouraging metabolic activity is prolonged hot treatments. So typically as temperature rises, metabolic activity also increases. And then interrupting it by short cold application. And what that does is it essentially functions as a blood pump and increases the circulation. We talked about that at the very beginning, how hydrotherapy can function as a secondary pumping mechanism outside the heart. So you can use an alternate or a heating compress. This is an example in the picture there, a person who has a kind of a large area heating compress. This one actually extends down the back as well and can be used in different positions. So it can be put in a hydroculator or into a microwave or an oven to heat up the internal media, whatever that might be, beans or rice or other types of things. So another goal or objective of hydrotherapy is blood cell formation, known as hematopoiesis. And the cold treatments in general are very good for stimulating blood cell formation. And that's a good thing. We need to have blood cells, both white blood cells and red blood cells. So a general overall, so like a cold shower, a cold bath, using it at a cool level to a cold, even very cold. It also increases the metabolism of the various glands of the body. Just think about jumping into a cold bath. What gland do you think is probably going to be exercised there? Well, probably your adrenal gland is going to get a nice burst. So that helps to just activate the various glands of the body. It also is helpful in people with anemia, using a short cold bath. The colder, the better. So anemia is iron poor blood. It can increase the blood cell formation and have more circulating red blood cells to carry oxygen. They must be very short in duration in order for them to be beneficial for anemia. A cold mitten friction or a cold towel rub can also do that if used 2 to 3 times per day, and can be a very excellent stimulant of blood cell formation. So someone who maybe has internal bleeding of an unknown origin, is losing blood to the interior, or someone who's wanting to have a higher oxygen carrying capacity for whatever reason, these could be some things that could help increase the blood cell production rate to help keep up with those deficits. The below is a diagram of a large bone. This is a femur, and the red part is the red bone marrow. The red bone marrow is where your red blood cells originate from, and there's various different progenitor cells. It divides into two. You have your lymphocytes, which are your T cells, your B cells, and your natural killer cells and plasma cells. Those are part of your immune system. Then you also have the other part of your immune system, which are your eosinophils, basophils, monocytes, neutrophils, and macrophages. And then your erythrocytes, which are your red blood cells. And very interestingly, red blood cells are anucleate, which just means that they shed their nucleus prior to becoming functional. So they have a lifespan that is much shorter than other red blood cells, not red blood cells, but cells in the body, including white blood cells and other blood cells, because they retain their nuclei. And that's what you see as the darker stained areas are the nucleus of these cells. But red blood cells don't have their nucleus when they're actually functioning as oxygen transport, as well as toxin and metabolic byproduct transport in and out of the body. So that's just a flow chart of the differentiation, kind of a family tree, so to speak, of blood cells. So another goal, increasing local and systemic blood supply. So a local would be like in a hand, systemic would be entire body. You want to use cold treatments, not using hot to do that. So the goal is to move fresh, nutrient and oxygen-rich blood to and from an area that needs greater circulation. So there's some kind of congestion, some kind of an issue there. Maybe it's a bruise or a break, for example. So a broken bone can heal more quickly when subjected to hydrotherapy. It just calcifies more quickly, and with the blood circulation, bringing the nutrients more rapidly to the area. Another thing that can, in addition to the hydrotherapy, that aids bone repair is lots of leafy greens. Lots and lots of greens is very helpful for calcium and getting that into the body. So that increased blood circulation removes the various toxins and metabolites of metabolism, or toxins that could have come from outside the body, helps to fight disease processes. And you can do surface applications of cold, so that's at the skin level as opposed to interior. And that stimulates the activity of the heart, which stimulating the heart is going to increase the pumping in the circulatory system. It's going to cause an elevated blood pressure and flow. So if you're working with someone who has a history of high blood pressure, maybe has an elevated high blood pressure, just take care as you administer this. It increases the flow of blood and the lymph. Typically, the lymph moves through the body through the squeezing action associated with muscles, the large muscle groups, in the legs and in the torso as you move about. So we're made to move, and that whole lymphatic system is designed to move through our own body movements and become stagnant if you aren't moving. Also, something that can increase systemic blood supply or local blood supply is anything that functions as a tonic. So a tonic is just a term that tends towards health. So something that tends towards health, and in many ways that's functionally accomplished through increasing blood circulation. You can also do a cold compress to the heart area if a general cold treatment isn't feasible. So some people may be feeble So the bottom list here shows where general cold, like a bath, is not indicated for. So a fever, heart or kidney disease, someone who's feeble, chronic tuberculosis, wasting disease, those types of things, you wouldn't want to completely immerse them in cold water because it may take too much out of them. So a local application can do the same, have the same effect as a total immersion. So when that's not a feasible protocol, just use a local. So you can also increase the body's ability to produce heat. So kind of tricking the body into being more productive of the heat. So an impression of cold to the skin nerves is the best way to increase metabolism. And when you increase metabolism, you increase heat production. So a cold breeze on somebody, you can think about how all of a sudden you get goose pimples and your hair stands on end as you're cold. You haven't started shivering yet, but you could go into a shiver. The shiver is part of the body's mechanism of increasing metabolism and trying to increase heat production through muscle movement in a shiver, as opposed to actually just moving. So generally, the more intense the cold, the better for that impression when it is wanting to be utilized for producing more body heat. So the most pronounced effects are seen when the cold is intense and prolonged, to the point where you have a slight temperature drop in the total body. So you would want to monitor that, just a slight. So 98.6 is normal, 98.5 or 98.4, that's a slight drop. You can negate the effect of the treatment, i.e. you're not going to get the warming effect from the cold treatment if the cold treatment is too long, or if the intervals between those applications are too short. So any technique of applying cold to the skin affecting the nerves can help increase the heat in the body overall. So this is an ice bath here. Someone, after having done some athletic activity, has been dunked into an ice bath. And that will actually, once out of that, will actually promote the metabolism of that area, increase the circulation and the clearing of the lactate and other metabolic byproducts of the muscular activity, and also have a warming effect associated with it. Another goal is to improve the ability to release heat. So sometimes people are unable to offload the excess heat, and then you have a fever that begins to build. So that's what most fever is a result of, and not being able to release heat fast enough. So some various techniques would be a vigorous rubbing in a cold or full or shallow bath. So while the person is in a bath, just rubbing them. A wet sheet rub, so using a wet sheet that is kind of sopping, not wrung out. A wet sheet pack, a very short hot followed by short surface cold application. So that's kind of a contrast application. A cold friction bath, and we'll get into more of the details on how these different things are applied later on in future presentations. But drinking cold water, so that certainly is a way, because water has a high heat capacity, and that's where all these work functioning, because the high heat capacity of water, it absorbs a lot of heat. To change the temperature, raise it 1 degree Celsius, it can absorb a lot of water, and so it's very good at reducing body temperature. A cold enema, so if the core of the body is heating excessively or needing to offload heat, an enema can be a good way to do that, getting it into the interior of the body, into the colon. A spine cold application, like the lady has here, probably wouldn't be standing up doing this, so they're just illustrating the device here. An evaporating wet sheet pack, and there's other ways that can help offload heat as well. So nervous irritability and pain relief. Someone is very irritable and nervous. A general neutral bath, that is a body temperature water bath, can be sleep inducing. Can help people who have insomnia or delirium. So delirium is typically associated with fevers. Can be chemically induced too. So an acute fever is typically a delirium and hallucinations can sometimes go hand in hand there. Moist abdominal bandaging, a cool head cap. So that's like one of those flexible ice bags you can put on your head. A spinal heat compress. So that can also help the nervous irritability and pain relief. So localized pain and irritation. So hot fomentation is a heating compress. So for example, if you bruise your hand, you might want to do the cold and ice compress for superficial pain and direct application right to the place where the incident occurred, as opposed to referred application. We talked about some of those pressure points or referential points on the body that can help have an effect at a point distant to itself. So one of the other things is to help combat bacterial proliferation. That is the growing of bacteria. And a couple ways you can do that is increasing the blood flow through the affected area and increasing white blood cell activity. So not only activity, but the production of it. So prolonged cold can be one area to do that. So direct it directly to the area that is infected. So if someone had an abscess in a finger or something like that, a cold soak could help that significantly. If you had a deeper infection, you could just increase the blood alkalinity. And one way to do that is through a general cold, that is a bath. And you can increase the white blood cell activity through alternate or renewed heating compresses. So you can also combine that with an alkalizing diet. And there's just a few examples of alkalizing food, and there's a lot of different ones that are very good. All vegetables and fruits tend towards a more alkaline end of things, although there are some that are more effective than others when you look at various charts. But that can help to prevent the bacterial growth and expansion. So you can also modulate blood volume and the movement of blood throughout the body. So you can draw it from one place to another. So slow blood flow and lymph promote waste accumulation in the body tissues, and that encourages them to essentially start to die because they're toxically activated. Remember that motion is lotion, that it helps to move, the body to move is very good. And we were made to move. In the Health Reformer, it was stated that in order to have good blood, we must breathe well. And that's just one aspect of it, is having a good respiration. We have that shallow breath. Our respiratory system is a primary method for off-gassing CO2. And if we don't do that adequately, we can end up with a more acidic state of the body just from our breathing. So revulsive measures of all types can be utilized for modulating blood volume. Hot leg and foot pack, a hot foot bath. So that's going to be drawing the blood to the feet from a congested area, say the head. Cold compress, and anything that helps to stimulate white blood cell activity and anti-congestion. So in Bible hygiene and Christian temperance in the Bible hygiene, it's noted, just referring to the blood itself as far as being good blood, that flesh meats, butter, cheese, rich pastries, spiced foods, and condiments are freely partaken of by both old and young. The blood-making organisms cannot convert such things into good blood. So just some reminders of things, some things to stay away from to help have your blood functioning at its optimal capacity. And then you can affect its movement around the body by doing hydrotherapy treatments. So lessening of heat production, so reducing the amount of heat that's produced by the body. So fever discouraged by short hot surface treatments, followed by prolonged cold or frequent changes in the cold. So some examples of that would be a short hot treatment and then a short hot full bath or a hot blanket pack, and then spine fomentations and a hot evaporating pack sheet. So essentially what they're doing is reducing the need of the body to produce heat by providing it. Another purpose for reducing heat elimination. So sometimes it's necessary, not very often. So fainting is a case where you might want to have the heat retained, so it prevents excessive heat loss from someone who's fainted and maybe is unconscious. So a dry pack or has been unconscious, a hot blanket pack, a hot enema, hot water drinking. You'd only do that when the person was conscious, of course. Avoiding drafts and interrupting heat with a brief cold. So vigorous cold wet rub or cold mitten friction intensifies or synergizes that cold application. You can also, with hydrotherapy, slow metabolic activity, so reduce it. So along with this, absolute bed rest can slow metabolic activity. A neutral bath slows metabolic activity, and hot foot bath and other types of things that derive derivative therapies, moving blood from one place to another and drawing it away from the area that is of concern. So hydrotherapy control of bleeding is also an important method of using hydrotherapy. So a direct application or use on reflex points. So if you're using it direct, you want to use either very hot, so 110 to 115 degrees Fahrenheit, or very cold, one or the other, 32 to 40 degrees Fahrenheit. So hot compress is best hot. A jet of hot water vapor can also work for that. Usually you don't think of hot as being a blood stauncher because heat tends to vasodilate, but it does have that effect if it's hot enough. So a nosebleed, you could jet of hot vapor or hot water compress to the face, a hot nasal spray, hot sponge to the face. So again, it's 110 to 115 degrees. That's pretty hot. Menstrual excess, a hot vaginal douche. Postpartum hemorrhaging, so this might be more frequently encountered. A hot uterine irrigation. You can use cold as well. So ice compresses directly to the area of a nosebleed. Indirect, a nosebleed will respond to cold to the upper spine or feet in cold water. Found that kind of interesting. So that's indirect. Again, a reference point that's affecting somewhere else in the body. Lung hemorrhage. Might encounter this, a cold to the chest and a very hot pack to the back and the neck and the upper spine. That's very interesting. And then ice to the nostrils constricts the lung vessels. So ice just right up in the nasal nares can help to constrict the lung vessels. And that's probably part of the diving reflex, which is something that we used to do in biology lab. We would have students go and test their heart rate and then dunk their head in a pan of ice water, and also monitor their heart rate. And there was a marked, just immediate decrease in heart rate associated with the drop in temperature and their face in the water. So stomach hemorrhaging, swallow some ice or use an ice compress on the exterior. So apoplexy is otherwise known as unconsciousness. It's an incapacity from a hemorrhage or a stroke to the head. So you can use an ice cap or a cold ice compress to the head or face and neck. And this is a little pack that you can fill with ice and put on the head. So one thing you need to be just aware of is what the signs and symptoms are of someone who has had a stroke or a cerebral hemorrhage. So you have reduced alertness that is not normal, visual disturbances and changes, a severe headache that's not normal, and a loss of motor skills on one side or the other or both. And they can be from different things. It can be an aneurysm or a broken blood vessel in the head. It could be a bleeding disorder. Typically or it could be trauma based or even a tumor based, but most of the time it's a brain bleed that's from an aneurysm or a broken blood vessel. So one of the best ways to do while you're getting additional immediate attention as soon as you can is put a cold pack to the head and face and neck. So to review the information here, you can go to preparingforthetimeoftrouble.com and to review past presentations. That's also archived there, and you can look forward to future presentations as well.